Hi, everyone. My name is Miki. I'm a physical therapist and I work over at the Neuroscience Center. Today, I'm just going to be talking about falls prevention. So, as a physical therapist, it is my job to help prevent falls. And why is it so important that we prevent falls? And why is it important to talk about? Well, first of all, we should talk about what can happen after a fall. There are risk of broken bones. Um, the falls can also cause head injuries, and our head injuries can be very serious, especially if you're on blood thinners, which some people are after having a stroke. Um, if you do have a fall and hit your head, you want to see your doctor right away to make sure there's no internal bleeding. Injuries from falls can also decrease independence and make it hard for a person to get around or do everyday activities or even live on their own. And if you do fall or experience multiple falls, you could become more fearful of falling. And this fear may cause you to decrease your everyday activities, and that in turn causes weakness and increases the chance of falling if we're not practicing walking or balance every day. So we really want to be aware of the risk of falls and how to prevent them so that we can stay more independent. A few stats I just wanted to pull for you are 1 out of 5 falls cause a serious injury. So a broken bone or a head injury that we talked about before. 3 million older adults are treated in the emergency department for falls every year. Every year, over 800,000 patients are hospitalized due to a fall and having a head injury or a hip fracture. So it's highly prevalent that we're seeing falls leading to another injury. Over 95% of hip fractures are caused by falling, and each year at least 300,000 older adults are hospitalized from hip fractures. And falls are the most common cause of a traumatic brain injury. So there are a few risk factors of falling: increased age, just in general, fear of falling, which we talked about before, cognition. If you use a device such as a walker or a cane, having weakness, vitamin D deficiency, difficulty with walking or balance. Also, there is use of medicines that can cause increased risk of falling, such as sedatives or antidepressants. Polypharmacy is something else to be aware of. If you're taking multiple medicines, sometimes you could become dizzy. So, making sure and talking with your doctor that the medicines you're on aren't going to have side effects of dizziness that could lead to a fall. Vision problems, if you have an issue with seeing correctly, that does put you at a higher risk of falling. And then foot pain or poor footwear. So if you're in sandals that come off really easily, your slippers that kind of slide off your foot, that can put you at a higher risk of falls as well. Home hazards such as broken or uneven steps, throw rugs, or clutter on the ground that you can trip over. So the more risk factors that you have, the greater the chance of falls. Some home modifications that we recommend are to, first of all, remove any items that you could trip over. So anything that's on the ground, throw rugs, anything that can easily be removed, we recommend removing it. Adding grab bars inside or outside your tub or shower or next to the toilet. Just our bathroom is generally a little more slippery, so having something you can hold on when you're getting in and out of the shower or up off the toilet. Making sure that you have railings on both sides of the stairs, just so you can hold on with both hands as you go down your steps. Add light, so night lights, or brighter bulbs for nighttime negotiation of your house is really important, especially if you get up in the middle of the night to go to the bathroom or for a glass of water. You want to make sure that your hallways and bedroom are lit enough where you can see if there's anything you could trip over. Um, Also, keeping items lower down in your cabinets are is helpful because then you don't have to use a step stool or go on your tippy toes and challenge your balance that way. Everything that you would use daily is in a, an easy, accessible place. Putting in some non-slip mats in the bathtub or shower floors kind of with suction on them so they're not going to come up, but it decreases the risk of slipping on your shower floor. If you do have any questions regarding kind of setup of your home or any home modifications, you can always come back to physical therapy or occupational therapy and talk about these for safety. Fall pendant options, so there's a bunch of them. I recommend if you live alone that probably having a fall pendant option is a good idea. So there's many of them now. So there's Google Home or Alexa that just kind of sit there where you're able to speak into the speaker if you do have a fall and have that Google Home or Alexa call someone. An Apple Watch, the Apple Watches nowadays can detect like a quick movement down towards the floor. So if you do fall, it'll ask you, did you fall? And you can say yes. And then it will have kind of emergency contact in there to contact who you set up for your Apple Watch to call. The other thing is if you fall down and you can't press that button, it's automatically going to call that emergency contact. So it is a good option just for that automatic call. There are phone apps. Uh, a couple of them are Fall Safety Home, Fall Call Detect. These again, I think it can detect that you have fallen, but you need to have your phone on you at all times. So some people will buy like a little purse that goes around the neck or a little bag so that you do have your phone with you if you do fall. And then there's fall pendants. Those are kind of the original options like Life Alert, Lifeline, where it can either go around your neck or around your wrist. And if you fall, you press that button. Um, I'm I don't know which one would work best. I'm not necessarily saying that you need to get one of these options, but it is good to have kind of a plan B if you do fall, and especially if you live alone or are walking alone. Another item we should talk about is just assistive devices. So there are many types of what we call assistive devices, but walkers, canes, wheelchairs, and then there's those grab bars or shower chairs that can help. Um, Everyone is so different in mobility that I really do recommend going to see your physical therapist to make sure that you have a device that works for you. If you feel like you're having trouble with your device, come back to physical therapy so that we can assess and make sure that you have the device that fits you the best. Basically, it should decrease your fall risk and increase your mobility is the overall goal of assistive devices. And with that increased mobility, you have increased independence, and that's overall what we want for you. Other recommendations are talking with your doctor. We kind of chatted about this earlier to review your medications to see if any of these would cause dizziness or sleepiness. And then if your doctor and you talk about it and you need a PT or OT evaluation for balance dizziness or activities of daily living, those are things you can talk with your doctor about. Or to visit your eye doctor. If you feel like your vision isn't as sharp as it used to be, you're not seeing little things, going to that yearly eye checkup is really important to just make sure that we're seeing everything. Um, as sharply as we can to help prevent those falls. If you do have any specific questions, you can always schedule an appointment. I have our number here for the TRIA Physical Therapy Department. So again, I'm at the Neuroscience Center, but and so we do specialize in patients who have experienced stroke. So you can always come to the Neuroscience Center for that. Um, I hope this was helpful. And here are a list of references. Okay, stay safe and thank you for listening.